Hi everyone, I'm Dr. Madhumita and you know me as Medico Madhu. Today, I'm going to tell you about one of the interesting patients that I had met. So, he is a young 16-year-old boy who came to the emergency with left lower abdomen pain. He was having severe pain and his only history was that after the pain started, in like 10-15 minutes later, he started having a little bit of loose motions. And when we asked him how long the pain had lasted, it was only for the last 3 to 4 hours that he had been having the pain, and he had multiple episodes of diarrhea during that time. So we investigated him and then we came to know that he had appendicitis. So a lot of people must have had appendicitis, and many of you would have known that appendix is an organ that exists on the right side of the abdomen, on the lower part. Yes, you are correct. So why did this boy have left-sided pain? That's because his organs were rotated. So before we were born, when we were in our mother's womb, our body is actually in the mirror image position. So only later on it shifts to the normal side, that is where it is actually present currently after we have come out of our mother's womb. So in this boy that did not occur, that's why he had left-sided pain. And then we explained to him, we had to put him on IV fluids, we had to start him on antibiotics and then took him for the operation. He is now doing good after the surgery. He has recovered completely well. So I'll be telling you a little bit about appendicitis in this video. What exactly is appendix? It is an organ in the right side lower part of your abdomen cavity. So appendicitis is nothing but swelling or inflammation of this particular organ in your body. Appendicitis usually presents with, it doesn't have to be just the right-sided abdomen pain. It can be in the middle, in the navel area, or it can be in the lower abdomen. You can present with nausea, you can present with vomiting, you can have diarrhea, you can have constipation. Any of these things can occur. That is because of the irritation to the intestine that is present. So you would be manifesting in different ways. So you would also be noticing this pain becoming a little vague anywhere in the abdomen area. It can be more so when, let's say that I am pressing your left side, you would have pain on the right side of your abdomen. Or when you are turning your leg to the right side or left side, you would have pain in the lower abdomen. Or let's say that you are folding your leg or extending your leg, you can have. When you cough, you might have a pain in the right lower abdomen. All these are the common ways by which you will present. Touching your abdomen would cause severe pain. This can get complicated and the complication can also manifest later on. Now coming about how are we going to diagnose it. Once you get admitted, we would be doing a battery of blood tests that would help us in telling your prognosis, that would help us in treating the associated problems that exist with this appendicitis. The main treatment option that we have is basically surgery. We remove your appendix. But when you present to us, you can come with complication also. Let's say that you have a ruptured appendix or there is an abscess, there is pus forms which gets collected. This is called as an abscess. Then this abscess has to be drained. We will have to give you IV fluid. We will tell you to keep completely empty stomach before the surgery, and we would be giving you IV antibiotics and other supportive care, painkillers, etc., so that you are comfortable before we shift you to the operation theater. So is blood test alone enough before we take you for the surgery? No, depending on your presentation and depending on the conclusive findings we get, we will be going for ultrasound abdomen, CT scan, MRI, etc., depending on our need. After the surgery, do you have any other complication? What I told you was free of complication. That is before the surgery. When you present to us, you can present with an abscess. It can rupture, it can perforate, causing an intestinal infection. So for which I have told you that you will be requiring this treatment. After the surgery, you can get in the surgical site, there can be an infection. The place where we have cut, over there you can have a little bit of infection. So these things we will tell you how to take care of yourself, how to prevent the infections. You might have pain in that side post surgery for few days, which would settle down over a period of time. We will be giving you medications for that. Surgery, can I have a minimal invasive surgery? Are there different options? Of course, you do have options. It doesn't have to be always an open surgery. It can be laparoscopic, it can be robotic as well. The recovery is much faster with these procedures. It's not a very important organ in your body. Your doubt would be, can I survive without an appendix? Am I going to have any restriction in my diet after the surgery? Do I have to change my lifestyle? Can I lift heavy weights after that? Well, the answer to this question is, first one, it is not a very important organ in your body. So after the surgery, no specific changes are required. There is no diet restriction that is needed. And regarding your exercise, you can start your exercise just like any other abdomen surgery. You can start lifting weight after 6 months of surgery. Please come to us for your revisit when we call you so that we know whether it has healed properly or not. I hope this video was useful for you. I would be meeting you with many more interesting videos. Thank you.